So here we're going to talk about the cardiovascular system, the veins and the arteries of this particular model. So if we look at the arteries, I want you to see that from here to here, it's ascending from the heart. So we call this the ascending aortic arch. And this is the aortic arch, this arched region of the aorta. And then from about here to the diaphragm, we call this the descending thoracic aorta. It passes through the diaphragm and it comes out here, where we then call the rest of the aorta the descending abdominal aorta. It splits into the right and left common iliac arteries, which we'll talk about in a second. So going back up to the arteries above the heart, I want you to see that this first branch is called the Brachiocephalic Trunk. If you follow the Brachiocephalic Trunk, you see that it splits here and here. This is called the right common carotid artery, and this is the right subclavian artery. If we go to the left side, this is the left common carotid artery, and this is the left subclavian artery. As we said, the aorta passes through the diaphragm. Immediately after it passes through the diaphragm, this major branch called the celiac trunk leaves the aorta. There are three major arteries that branch off of the celiac trunk. This is the gastric artery, the hepatic artery, and the splenic artery. Immediately inferior to the celiac trunk is this superior mesenteric artery. If we continue down the descending abdominal aorta, you can see the inferior mesenteric artery. The aorta branches into the right common iliac artery and the left common iliac artery. It further branches into the left internal iliac artery and the left external iliac artery. On the right side, we have the right internal iliac artery and the right external iliac artery. Lastly, we have the renal arteries, the right renal artery going to the right kidney, and on the left side, we have the left renal artery, which would go to the left kidney.